over 10% of the US population suffers from type 2 diabetes. More than likely, you know someone with diabetes in your family, have diabetes, or are at risk for developing it yourself. Today, let's review what type 2 diabetes really is, what the risk factors for developing it are, and its medical complications, and how doctors diagnose it. Unlike those diabetes genes, you don't want to miss this. So what is type 2 diabetes? Well, about 95% of all diabetics diagnosed actually have type 2. Unlike type 1, diabetics who simply don't produce enough insulin, type 2 actually have insulin resistance. This occurs when the body's cells become resistant to the effects of the insulin. After a meal, glucose is absorbed through the gastrointestinal or GI tract into the bloodstream. Then this circulating glucose stimulates the pancreas to release insulin, and then insulin then binds to like a doorway of sorts referred to as a receptor on the outside of our cells, and this triggers other receptors on our cells to open and then allow glucose to enter the inside of the cell. And those with type 2 diabetes often have impaired insulin receptors, which means that their cells are resistant to insulin, hence why it is referred to as insulin resistance. You got it. When this receptor is dysfunctional, glucose has a difficult time entering the cell. Hence, this elevated glucose outside the cell and in the bloodstream then triggers the pancreas to release even more and more insulin in order to attempt to push that glucose into the cell. Hence, this elevated insulin circulating in the blood then causes weight gain and hunger, and hence even more insulin resistance. It is a vicious cycle. So what are the risk factors for developing it? Well, about 39% of diabetics have at least one parent who also has the condition. Weight gain specifically also significantly increases the risk of developing diabetes. With increased weight, our receptors become even more resistant. Diminished physical activity is also another risk factor, and exercise alone without actual weight loss, interestingly, has been also shown to decrease insulin resistance. Medication side effects. Most common culprits are corticosteroids and antipsychotics, which are used to treat bipolar disorder and other mental health conditions. Unfortunately, some diabetes medications can also ironically cause weight gain. Yes, such as the sulphonylureas like glipizide and glyburide, and of course, insulin. This is the reason that type 1 diabetics, for instance, are often thin because they're missing insulin in their body and or they're underweight. But when given insulin, they actually gain weight. Insulin will also cause weight gain in type 2 diabetics too. However, they are already overweight. People with other insulin-resistant conditions are also more likely to develop diabetes in their lifetime, and these include those with a history of gestational diabetes, polycystic ovarian syndrome, metabolic syndrome, and fatty liver. So what are the complications of type 2 diabetes? I mean, why do we care about it? Well, if left untreated, diabetes can actually cause some very serious complications. Chronically elevated blood glucose levels eventually damage the lining of the blood vessels, and when this involves the smaller blood vessels, we actually call this microvascular disease. Hence the term micro. Damage the supply to the eye to cause retinopathy, the vessels that feed the nerves to cause neuropathy, and the vessels that supply the kidneys. Diabetes is the top cause of dialysis, yes. When diabetes damages the larger blood vessels, it is often referred to as macrovascular disease. This actually contributes to the development of even graver complications like heart attack and stroke. Cardiovascular disease is the top cause of death in both men and women in the United States. Diabetes is one of the top risk factors contributing to cardiovascular disease. That is no secret. Interestingly, glycemic control, meaning strict lowering of glucose levels with medication or treatment, has not been shown to significantly reduce macrovascular complications, meaning heart attack and strokes, and those with long-standing diabetes as much as it has for microvascular complications. So controlling blood glucose levels will best reduce your risk of developing things like retinopathy, which is vision loss, or going on kidney dialysis, or nerve pain. I mean, also terrible things. You don't want any of those things to happen. Hence, it will most help improve your quality of life if you have had diabetes for a long time. Now, on the other hand, to reduce the risk of macrovascular complications, what has been shown to be most effective is reducing your other risk factors for heart disease besides diabetes, such as quitting smoking, reducing your cholesterol, and most importantly, controlling your blood pressures. What I often tell my diabetic patients is that the one thing that I can do to improve your lifespan and save your life is to control your blood pressure. Yes. Therefore, controlling your blood glucose will help improve your quality of life, and controlling your blood pressure and other risk factors will help increase your quantity of life. But we know they go hand in hand. So how do we screen for diabetes? Well, screening for it has actually become quite easy in the recent years with the development of a blood test called the hemoglobin A1C. Most doctors no longer use the antiquated glucose tolerance test where there's a high glucose containing solution that is consumed and then blood glucose is measured after consumption. Nor are we relying on fasting blood glucose measurements, because if you catch a diabetic on a good day, that fasting blood glucose can be deceivingly normal. The convenience of the A1C has replaced the previous methods, as patients are no longer even required to fast prior. Yes, and the test is a quick blood draw. Hemoglobin now is a protein that's present in red blood cells that helps carry oxygen throughout the bloodstream, and glucose tends to bind to hemoglobin. And because red blood cells typically survive for 3 months at a time, the test can actually reflect the average amount of blood glucose that's bound to hemoglobin for the past 3 months. Yes, it's hard to deceive us on this one, you guys. It's pretty accurate. An A1C level of 5.6 or lower is considered normal, 5.7 to 6.4 is pre-diabetes, and 6.5 and higher indicates diabetes. For those who have been diagnosed with diabetes, most people's treatment goal is to remain below 7%, which typically equates to about an average of 152 blood glucose level. However, it is reasonable to set more aggressive goals, even less than that, to less than 6.5, and those who are younger, healthier, and have a greater life expectancy. Now, if you found the information valuable, which is always my goal, please give it a like, hit that red subscribe button along with that notification bell next to it so that you don't miss any of my future videos. And please feel free to share it with someone else who may find it useful. Thanks for tuning in. Keep those blood glucose levels down, and I'll catch you next time.